Hello, everyone, and thank you all for joining us today for our webinar on the 2019 MIPS reporting year. I hope all of you wrapped up your 2018 MIPS reporting strongly and are expecting to do well there. And hopefully you were able to take a week or two and enjoy things, relax a bit before beginning to refocus on 2019 MIPS reporting. But I really do appreciate all of you joining us today. Just know that our presentation is available for you to follow along in our handout section of the GoToWebinar widget. So feel free to go ahead and download that and just follow along with me today. Now, my name is Asman Sufder. I am an account executive here at HealthMonics. I primarily work with many different medical practices that we work with in order to help them just prepare for MIPS reporting and really help them implement our MIPSPRO solution, our CMS qualified registry. Joining me today is our communication specialist, Christina Zink. She'll just be on standby if anybody has any questions about any of the topics that I'm covering or other topics related to MIPS reporting. So to also just know in the questions portion of our GoToWebinar widget, there is a section where you can submit anything. So if at any point in time, if I'm on a particular slide that is confusing, or if you would just like clarity in something that I've stated, feel free to ask a question and we'll be able to help out. And so for today, we're just going to review the highlights of the major changes for 2019 reporting before diving into more detail about the different MIPS performance categories. From there, we'll discuss scoring and submission, and finally, we'll have an open Q&A, and I'll also take a moment to show all of you, if you would like, our MIPS Pro demo. And again, here at HealthMonics, we do have a CMS qualified registry called MIPS Pro, and I think in showing that, it'll help you get a better understanding of what can be done to not only just meet the minimum requirements for MIPS reporting, but really make the most of it, really strive to make improvements to maximize your overall incentives. So without further ado, we can go ahead and begin diving into today's presentation. So what's new in 2019 MIPS reporting? Well, there are a couple of big changes. The first occurs with the quality category that, again, for another year of MIPS, is being reduced from being worth 50% of your final score all the way down to 45% of your final score. Additionally, eligible clinicians are now able to submit a single quality measure via multiple collection types. And in a little bit, I'll dive into more of what that really means. The 5 points that were taken away from the quality category have now been added to cost, which is worth 15% of your final score. Additionally, for improvement activities, not any really significant changes. Just be mindful that the promoting interoperability bonus has been removed. Speaking of promoting interoperability, this category has had some of the most significant changes in MIPS reporting. So please know that for this category, eligible clinicians must be on a 2015 edition certified EHR technology. There also is a new scoring methodology for promoting interoperability that is now performance-based that we'll also dive into in more detail later in our presentation. And another major change is the performance threshold has increased. So in the first year of MIPS, the minimum required was just 3 points. For 2018, that increased to 15 points, and now that has doubled to 30 points. So if you do want to, at the very least, avoid what is now a 7% penalty from CMS for failing to report MIPS, just know that you would need at least 30 points. And for those who are really looking to earn incentives, you would need to score at least 75 points now to fall under what CMS calls their exceptional performance range. There are additional changes for MIPS reporting outside of each performance category. We now have a number of newly eligible clinician types. So in addition to physicians, PAs, nurse practitioners, and others being eligible to report MIPS since the very first year of the program in 2017, now beginning this year, beginning with 2019 reporting, physical therapists are eligible, as are occupational therapists, clinical psychologists, qualified speech language pathologists, audiologists, dietitians, and nutrition professionals. So just keep in mind, if you have a practice with multiple providers, or if you are a clinician who was previously exempt from MIPS reporting based on clinician type, that you might want to evaluate who is eligible for 2019. As stated, there are a number of new eligible clinician types. Now, if you are an eligible MIPS clinician type, if you are a physician, uh, a psychologist, a physical therapist, or what have you, there are still additional MIPS eligibility exemptions that exist. So even if you are, for example, a physician, but are newly enrolled in Medicare, or fall below the low volume threshold, or are enrolled in an advanced alternative payment model, then you would be exempt from MIPS reporting. For example, if you bill $80,000 in Medicare Part B charges, see less than 200 Medicare Part B patients, or are providing less than 200 covered professional services, even if you are an eligible clinician type, you would be exempt from MIPS reporting. However, what is new in 2019 is CMS has introduced an option to opt into the program. So for the low volume threshold, if you exceed any of those three criteria listed below, you are able to opt into MIPS reporting. And the big advantage of doing so, in addition to just being able to track quality measures and receive an evaluation and performance feedback from CMS, you are eligible to gain any sort of the incentives for your MIPS reporting, which CMS has already conservatively estimated to be around 4% back in Medicare Part B allowed charges. So even if you might be exempt from your MIPS reporting, I really do encourage you all to opt into the program and really try to make the most of reporting and really aim to capitalize off of those incentives. Also, just know that if you are a part of a MIPS virtual group or were considering it, you certainly can do so. However, if you have not already um, submitted an election to CMS, you wouldn't be able to get approved for the current reporting year, but if you were looking to do so by 2020, you would need a designated rep from your virtual group to submit that election to CMS by December 31st of the calendar year prior to the actual performance period. So just to say that in another way, if you are considering a virtual group and haven't elected to become one yet to CMS, it is too late to do so for 2019. However, if you wanted to for 2020, just know the election will need to be made before the end of the year. And now that we covered some of the major changes for 2019 MIPS reporting, we're going to go ahead and now dive into the different performance categories in more detail. And of course, as I'm going through these slides, just a reminder to everybody, if you have questions, feel free to submit them to us through the questions portion of the GoToWebinar widget. And we're going to begin with the quality performance category. So even though quality has been reduced to 45% of the final MIPS score, it is still, the most involved, the most taxing category of MIPS to report. And what's needed in this category is of 240 plus quality measures that exist, you would need to have at least 6 measures selected. And just know that there are some measures that are very general, but others that are more highly specialized. So just as an example of a quality measure, there is one called measure number 130, which is just looking to see if a patient was seen in office and that their medications were documented. If so, to report that measure, you would just need to include that patient information when they were seen in office, and then just confirm that medications were documented in their record. And just know that no matter what provider type you are, we do have specialty recommendations for quality measures. So if you are struggling to find any, just let us know and we'll be happy to provide some recommendations for you. Now, when selecting your 6 quality measures, or at least your 6 quality measures, of those 6 measures, one would need to be an outcome measure. And if you are unable to select an outcome measure, a high priority measure can be selected in its place. Additionally, for quality reporting, CMS is looking for you to report on 60% of all patients across all payers throughout the entire calendar year. And you would need to report that specific information for each quality measure for at least 60% of your patient population for the year. And so just to compare that to changes from last year, as I stated already, it is now just worth 45% of your final score. However, participants are also able to now submit via multiple collection types. So what that really means is when you are doing your MIPS reporting, you can choose to go through a registry such as ours, MIPSPRO, but you can also submit quality measures through your EHR at the same time, and CMS will compile those scores together. Another change from last year is a policy relating to groups reporting the CAPS for MIPS survey. If the sample size was not sufficient, the total available measure achievement points, just know, would be reduced by 10 points, or in other words, you can receive an exemption for that. Also, another major change for 2019 for quality reporting is only small practices, which CMS defines as a group with 15 or less clinicians, are able to report by claims. Any practice that has 16 or more providers can no longer submit by claims and instead would need to go through a solution such as our registry MIPSPRO. There are also now extremely topped out quality measures, which really just means that these are quality measures that CMS has really capped what the total score is you can receive on them. So for example, each quality measure, one can earn a total of 10 out of 10 points. But for topped out measures, they do make it increasingly difficult or impossible to do so. And speaking of quality measures for the 2019 reporting year compared to 2018, 10 new measures have been introduced. However, 26 existing quality measures have been removed in an effort for CMS to really want to prohibit people from selecting the same measures over and over again, and really try to push people to select more outcome-based measures, more specialized measures as well. And so that is the quality category. We're now going to go ahead and jump into promoting interoperability, which some of you still might be familiar with as advancing care information. This category of MIPS is the second highest weighted category. And does account for a quarter, 25% of your final score. For this category, there is a 90-day minimum reporting period. Additionally, a 2015 certified edition EHR technology is needed to report this measure in the first place. So if you don't have an EHR, or if it has been decertified or is 2014 certified, know that you wouldn't be able to report this category of MIPS. Also, just know, however, that if you are a newly eligible MIPS clinician type, you are automatically exempt from this category. In other words, if you are a psychologist, physical therapist, occupational therapist, audiologist, and so on, you are exempt from the promoting interoperability category of MIPS, as are hospital-based clinicians, ambulatory-based clinicians, nurse practitioners, and PAs, as they have been in years past. So just to compare promoting interoperability from last year, it's still worth 25% of the final MIPS score. However, as I stated already, a 2015 edition certified EHR technology is required to even report this category at all. For measures, there is just one objective and just one measure set based on your EHR, as well as two newly introduced measures related to opioid treatments and PDMPs. Also, a new scoring method has been introduced for this category that is now all performance based at the individual measure level. So what that really means is, for each promoting interoperability measure, they are now going to be scored based on the MIPS eligible clinician's performance for that measure. So instead of just completing an attestation as you may have in the past, CMS is looking for actual numerators or denominator information, or rather yeses or nos, of the number of patients seen during at least 90 days and the number of patients actually meeting that promoting interoperability measure. For this category, there are a total of 100 possible points to earn. And also just know, though, that if any exclusions are claimed, you will get your score reweighted. Moving on from promoting interoperability, we'll go ahead and now jump into the improvement activities category of MIPS. Like last year, this is still worth 15% of your final score. And unlike quality and promoting interoperability, there haven't been really any significant changes yet in this category of MIPS. For improvement activities, there are more than 100 or so to choose from, all about increased patient engagement, increased patient communication, and all you would need to do is either select activities worth a total of 40 points, or just 20 points if you are a rural HPSA, non-patient facing clinician, or a small practice. And to do so, you can select between what are labeled as high-weighted activities, which are worth 20 points, or medium-weighted activities which are just worth 10 points. And to report this category of MIPS, all you would need to do is identify improvement activities relevant to your work, relevant to your practice, and simply attest to them and submit to CMS to get credit in this category. And also just know that if you are a patient-centered medical home, you are automatically receiving full credit for this category of MIPS and wouldn't need to attest or submit anything further. So just to compare changes from Last year for improvement activities, as I stated, it is still worth 15% of your final score. They have updated and modified the list of improvement activities to choose from, which I'll get into on the next slide. They also have modified their annual call if anybody wanted to suggest an improvement activity or make changes for an improvement activity. And also just know if you did want to do that, improvement activity nominations received in year 3, which would be 2019, will be reviewed and considered for possible implementation of year 5 of MIPS reporting, which would not be until 2021. Also, one of the earlier slides I mentioned, the promoting interoperability bonus has been removed for the improvement activities category. So we'll now go ahead and just review some of the changes and the inventory of improvement activities to select from. There are 6 new improvement activities to choose from. Um, Additionally, 5 improvement activities have been modified. Unfortunately, for anybody who's selected improvement activity PM9, participation in population health research, you would need to find an additional improvement activity to select as that one has been removed. And finally, we'll go ahead and discuss the cost performance category, which is the 4th category for MIPS reporting that does now account for 15% of your final MIPS score. Unlike quality, promoting interoperability, and improvement activities, which CMS requires something be reported and submitted to them, there is no additional work required for costs to get a score from it. It is instead automatically calculated from your administrative claims data. But like quality, the performance period is the entire calendar year. Also, just know that for the cost category, a number of clinician types, such as physical therapists and occupational therapists, are exempt from this category or will have their scores reweighted to the quality category. So if you do have any questions about your eligibility for cost reporting, I know a lot of us aren't familiar with it yet, feel free to ask us and we'll be happy to help out. So the compare changes from last year, though, it is worth more. It is worth 15% of the final MIPS score. For those eligible in this category, there are now an additional 8 episode-based measures added, which I'll get into on the next slide, in addition to the 2 other cost measures, which are Medicare spending per beneficiary and total per capita cost for treatment on Medicare Part B and Part A patients. And also just know to even be eligible for these different cost measures, a case minimum of 10 procedural episodes are needed and 20 for acute inpatient medical condition episodes. So here you can see what the 8 new episode-based cost measures are. These are highly specialized, which is why I stated many providers are actually going to get exempt from this category or can look to receive some sort of reweighting of their score within this category or to the quality category. All right, and now that we jumped into each MIPS performance category in more detail, we are now just going to touch on the final score and submission. So just again, if anybody has any questions, feel free to submit them to us and we'll be able to answer it throughout the rest of our presentation. So here you see a pie chart of how the total MIPS performance score is broken down. Quality does account for majority of your final score, being worth 45% relative to the other MIPS performance categories, and quality still really does largely involve most of the work for reporting purposes. Again, promoting interoperability accounts for 25%, and improvement activities and costs are accounting for 15% of your final MIPS score. There are bonuses to earn for MIPS reporting if you are a small practice. However, they are changing it from what they did last year. So small practice, which CMS defines as practices with 15 or less clinicians, were originally just receiving 5 points on top of their final MIPS score. They are now receiving 6 points. However, that is just going towards the quality category and not the overall final MIPS score. So just know if you are a small practice, you will notice that change when you begin tracking your MIPS reporting. Additionally, there are changes to the MIPS final score in who can receive an exemption or just get their score reweighted to 0. And those clinicians are those who are joining an existing practice in the last 3 months of the reporting year, and that practice is not participating in MIPS as a group, or those are clinicians that have joined a new TIN in the last 3 months of the performance period. So just know that if you have any providers joining in the last 3 months, or if you're forming a practice in the last 3 months of the performance year, which is the same as 2019 calendar year, if you're not already participating in MIPS as a group, that clinician would be exempt and you wouldn't have to worry about reporting for them. Before those providers who are eligible, these 3 different pacing options are really important to consider. And I touched on them briefly earlier, but CMS has doubled the minimum score required for MIPS reporting from 15 points to now 30 points. And in failing to score at least 30 points would result in an automatic penalty of negative 7%. So really keep that in mind. 7% is a lot, no matter who you are, to at the very least report the bare minimum. For those who feel a bit more comfortable that they can report more but are unsure how much they can invest into the MIPS program, just know that any score above 30, you can look to get some form of an incentive back, although be it minor. But those who are really looking to maximize their incentives, you want to shoot for a score of at least 75 to 100. And while CMS has originally stated incentives would be up to 7% or more conservatively, they have dialed that back and are projecting incentives for 2019 MIPS reporting to really be around 4%, which again, no matter who you are, can be really significant. So definitely encourage those who are able to invest in their MIPS reporting to really capitalize on those potential reimbursements, on those potential incentives. And you'll see here that the penalty and the incentives for MIPS reporting, which get paid out 2 years later from the performance year, are just going to continuously increase from year to year. And additionally, a provider's MIPS payment adjustment does follow them from practice to practice, and these scores do get posted publicly on Physician Compare. So just know that the MIPS final score follows providers from NPI, even when they're jumping from practice to practice. And also just know that when you do submit your MIPS reporting, they are available for the public to see on Physician Compare. So definitely encourage, again, people to report MIPS to at the very least avoid the penalty, but invest in it as much as you can and really try to, optimize your final score and really try to earn incentives. And for those who need help with it, our registry MIPSPRO can certainly help. So what I'm going to actually do right now before we dive into an open Q&A, where I'll read questions and answers out loud, is for those who are interested, for those who are looking for a MIPS solution, a MIPS expert, is take a moment to show everyone a quick demo of our registry MIPS Pro. So I'm going to go ahead and pull that up in just one moment. So I just ask everybody still in attendance to bear with me. And also just a reminder to everyone while I go ahead and pull up a demo of MIPS Pro, if you still have questions while you're digesting our presentation about 2019 MIPS reporting and different requirements, feel free to continue submitting questions now and even as I'm going through our registry MIPS Pro. And we're available to still answer your questions throughout. We do have roughly another 30 minutes left today. All right, so I appreciate everyone who bared with me while I went ahead and pulled up MIPS Pro. What you're seeing here is our MIPS Pro registry, which again is a qualified CMS registry and one of the top, I believe, top three largest vendors for MIPS reporting in this space. And so here you're seeing our MIPS Pro dashboard, and you'll notice that our system is able to support each performance category of MIPS, quality, promoting interoperability, and improvement activities. Additionally, we do have a cost tracking tool as well as tools to track any bonuses you're eligible for, as well as your revenue impact. And for the purpose of today, I am just going to focus in on the quality category because this is generally where most questions occur, and really, again, is where most of the work for reporting takes place. However, if anybody does have other questions about MIPS Pro's capabilities to support other categories of MIPS, or just would like a more in-depth demo, we can certainly provide that and help out. But you'll see here when I dive into the quality category of MIPS, in MIPS Pro, I'm immediately presented with a checklist that's really there to ensure in your reporting you're meeting each step required before moving forward and just help you stay on track. Additionally, you'll notice we have this little help button here to provide on-screen tutorials if you ever have questions in using our system. And even then, if you did need additional assistance, we really do have a wonderful stateside support team here that can guide you through this reporting process and assist in the rare event any sort of issues occur. Now, in MIPS Pro, the first step to do for the quality category is to go ahead and select your quality measures. Please know that for the 2019 reporting year, MIPS Pro has all measures available already, except the newly introduced measures for the 2019 reporting year. So whenever you are ready to get started with your MIPS reporting, our system's already live, already running, ready to help out. But you'll see here that in MIPS Pro, we do just confirm that you are meeting CMS's selection requirements in this category of having at least 6 measures, and of those 6, at least one is an outcome or high priority measure. Down below, I'm able to view which quality measures have already been selected, and for each one, I'm able to pull up its details in order to get instructions for this quality measure, a brief description, but then even further details such as benchmark data, which is really significant. It's how CMS is really evaluating your MIPS performance and providing that decile score out of 10. We also provide the denominator criteria information, which is stating if a patient is eligible for this quality measure, as well as numerator criteria, which states if performance is being met or not met in this instance. Now, in selecting additional quality measures, just know that MIPS Pro supports all measures that can be submitted through a registry. And again, for each one, you can view its details if you just wanted specifics on what's required for reporting. Also, instead of forcing you to scroll through 243 quality measures, there are a number of ways to filter through this list. For example, if there are any codes you commonly bill for, such as the ICD-10 or CPT code, that can be submitted here for you to view measures most relevant to you. Additionally, you can filter by different CMS specialty set or measure set. So for example, if you are a psychologist or a psychiatrist or just do a lot of work in mental and behavioral health, you can filter this list of 243 quality measures to just see those specific to your specialty. Also, in addition, if you're still having a really difficult time identifying your quality measures, in MIPS Pro, you can select them all, and our system is able to show you which ones you have data for, which ones you do well in, and I'll be able to dive into that in a couple of pages from here. But just know, in MIPS Pro, you can select all measures in an effort to really optimize your overall final score. Now, once you have quality measures selected in MIPS Pro, the next step is to go ahead and send us data. There are a number of ways we're able to do so. So for example, if you have an EHR and are able to export data from that EHR or practice management system, whatever you use, those files can then be uploaded directly into MIPS Pro, really so long as it is not a QRDA3 file. Additionally, we do accept billing files as well as CSVs or Excel spreadsheets. We also are connected with a number of EHRs, so if you feel we might work with your EHR or are just curious, please ask us. We can certainly discuss what it looks like when we are integrated with your EHR in that way. However, we are able to accept data from any system. They can, as I stated, just be uploaded directly here. There is no limit to how many times you can upload in your account. You can do it as frequently as needed and just really append all of your data together throughout the course of the year. And when you do upload data into MIPS Pro in real time, we're able to process that for you to provide quality performance feedback, scores, and analytics. So what you're seeing here in MIPS Pro is for each selected quality measure, we're providing a breakdown of the performance rate as well as the decile score, which is your overall MIPS score weighted against CMS's benchmarks. Additionally, we are able to break down your performance by provider. So you are able to, for example, let's say you had 20 providers in your practice, you can assess how those 20 providers are doing as individuals, even if you're reporting as a group in MIPS Pro, to determine, which providers, you might want to reward, but also which providers need extra attention, need extra help to ensure successful MIPS reporting. You can also receive snapshots for individual providers and then email or send them reports directly. Additionally, when evaluating your overall MIPS performance, you'll see that each number here is hyperlinked. So if there's a particular quality measure that you were expecting to perform better on that you aren't for whatever reason, you can drill down into why. So for example, measure number 48 here, we're really performing low, 68 did not meet the criteria. I can go ahead, select that 68, and now I'm able to view all patients who did not meet measure number 48 and go ahead and open up that individual patient visit. And this is also what it would look like if you were to manually document patient visits into MIPS Pro. So you'll see here a patient identifier exists as well as the date of service, the rendering NPI, and any sort of relevant codes. And if I scroll even further, you'll see here that for each quality measure, there is an abstract associated with it. that just asks questions, essentially trying to determine, is this patient eligible for this quality measure? And if they are eligible, did they meet performance? So for example, here, measure number 48, based on the answers here, this patient was eligible. However, based on this code being documented, the patient did not meet performance. Maybe that was a mistake. Maybe something needed to be updated. So you can go ahead and just manually make that change within our system or upload a spreadsheet correcting the misdocumentation. And from there, you're able to make the update, save that change, and proceed. And then if you were to go ahead back to the quality performance page, you'll see how that change ends up adjusting your overall score. And the last thing I'll show before ending our demo here is something really cool that MIPS Pro is able to do in addition to everything else is no matter how many quality measures you select, whether it's just 6, 10, or all 200 plus, our system is automatically able to pull up your top 6 performing quality measures that give you the highest overall score to really help you optimize that final score, get the highest overall performance, and therefore highest overall incentives back from CMS. And in addition to pulling up the top 6 measures, we're also showing you how you're doing in great detail for all other quality measures. And that's just a great way to assess which measures are your priorities, which ones maybe need more attention, or even which quality measures aren't really working out for you and no longer should be reporting. So this is really one of the best ways that MIPS Pro is able to help you improve your final score, help you find relevant quality measures, and help you get the highest score possible. And again, while our registry MIPS Pro is doing a lot of this work automatically, we do have a really wonderful stateside support team here to work with you through the process to navigate MIPS Pro, MIPS reporting in general, all the way through submission. So I just want to thank everybody for taking the time to view a demo of our registry MIPS Pro in addition to reviewing 2019 MIPS reporting requirements. We have just about 15 minutes left today, but I did just want to say thanks to everyone. Really appreciate you taking the time to join us. And we'll go ahead and stay online for the remainder of today's webinar. So feel free to continue submitting questions. We'll answer them for you. And in a moment, I'll go ahead and start reading some of them out loud. Thanks, everyone. All right, I just want to thank everyone who is still online and those who are submitting questions. I see a lot of great ones have been asked. So I'll go ahead and start reading some of those out loud, just in case anybody else has that questions or just find that information useful. So the first one here is actually really good. How do you verify that the data you receive from physician groups is accurate? And so the data we receive is uploaded or entered by the provider or these practices directly based on their own patient charts for the visits billed. So just know there is some form of an honor policy involved in MIPS reporting, so we do rely on our users to make sure that the data they document in our system is accurate. However, if you do have any questions about the data being entered into the system, into MIPS Pro, we can certainly assist you to ensure that everything is being tracked appropriately and everything is accurate. All right, we have another question for this portion. Are we required to be registered with a clinical registry? So there are different ways to submit to CMS. For example, if you're a small practice, you can do it by claims. You could report through an EHR if you have one. You can go to CMS directly. However, with MIPS Pro, you do have a 100% submission success rate. You know that you're able to track your reporting throughout the year. You have a wonderful team to help you when you have questions, and so you're on top of your reporting the entire time with the registry like MIPS Pro. And additionally, in addition to just having a 100% submission success rate, even post submission, we do assist with any sort of appeals or targeted reviews to CMS. So while you're not required to use a registry, there is a huge benefit to using MIPS Pro. Right. And now we have a great question about eligibility for different specialties. Could you comment again on the provider types that do not need to report for PI or promoting interoperability? So, providers who are hospital based or ambulatory surgical center based are PAs, NPs, nurse specialists, nurse anesthesiist, as well as any newly eligible MIPS clinician is exempt from promoting interoperability, but I do want to specify that if any of those provider types are a part of a group with physicians who are eligible for promoting interoperability, then those providers would therefore be eligible. So, for example, if you have a practice with 20 doctors in all, 15 of them are physicians, but another 5 are psychologists, and you're reporting as a group, those psychologists would still need to be a part of your promoting interoperability submission as well. It's just in cases where you're not reporting as a group or the group is filled with providers who are exempt from promoting interoperability. Right, we have a question now about improvement activities. Can you use the same improvement activity that you used in previous years? So yeah, if you want to continue selecting the same improvement activity, you certainly can continue to do so, so long as that improvement activity hasn't been removed. But as I mentioned, there was just that one for from 2018 to 2019. So long as you weren't reporting that one improvement activity, you can go ahead and select the same from last year. We have another question about eligibility. Do physical therapists need to report if they are billing under the practice? So physical therapists would need to report really, if they are enrolled in Medicare, there is a possibility that they are eligible and will need to be accounted for in your MIPS reporting. If you have questions about that, you can certainly check eligibility status directly through QPP. However, feel free to reach out to us directly as well, and we'll be able to help, discuss whether those physical therapists need to be included in your MIPS reporting or not, and also we're able to address any other questions or concerns you might have. All right, we now have a question about quality reporting. Um, you mentioned for quality measures, we must report at least 60% of all patients across all payers for the calendar year. So, should we be reporting these measures commercially also? So, yes. So reporting is across all payers, whether it's Medicare, Medicaid, commercial, out of pocket, whatever. 60% of all patients would need to be reported and accounted for. Okay, and we have about 5 minutes left. I'll continue reading questions and answers out loud. Also, just know though that if we did not get to your question yet, we'll certainly be following up with you so you do get an answer. Additionally, if anybody has questions later on, feel free to reach out to us directly. You'll see an email address is listed on the slide currently up. You can also feel free to give us a call directly. The number to reach Healthmonics and MIPS Pro is 888-720-4100. Again, that's 888-720-4100. So if anybody has additional questions, please feel free to call or email us directly. For those who submitted questions, we'll certainly be getting back to you. Thanks. All right, so we have a question. When will the 2019 measures be available on Healthmonics, MIPS Pro, and when can we begin to upload data? Great question. So MIPS Pro is already live, already up and running for the 2019 reporting year, with almost all 2019 quality measures available. The only measures that won't presently be available are just a few that are entirely new for 2019. However, all 240 plus quality measures for 2019 are available and can begin being reported and tracked in real time in our system. All right, we have another great question. Should reporting be year round or should it be submitted at the end of the year? So with MIPS Pro, we do have our registry open until the final day of submission. However, we really strongly encourage everyone to be reporting throughout the year. As you saw, there are a number of ways for you to track your performance throughout the year and make improvements over time. So we definitely encourage everyone to get started with their MIPS reporting, get started with MIPS Pro as soon as they realistically can, so we can work with you throughout the process instead of just at submission to ensure everything goes through successfully and ensures you're earning the highest score possible. All right, and I'll just read aloud one question here. How much does your service, how much does MIPS Pro cost? So that does depend on which performance categories you wish to report. So if you would like to inquire more about the cost of our services, feel free again to reach out to us directly. You can email at webinars@healthmonics.com or give us a call at 888 720-4100, but our prices for MIPS Pro do start at $289 per provider. However, if you want additional details, certainly feel free to reach out to us and we can follow up with you to provide more detail. And since we have just a minute left before we need to shut down here, I do again just really want to thank everyone who took the time out of their busy days to learn about 2019 MIPS reporting requirements and see a demo of MIPS Pro. For those whose questions we haven't answered yet, don't worry, we'll certainly be following up so you do get a response from us. And for anybody who has a question later on, once they've had an opportunity to digest this, review our follow-up email, which will include a recording of the demo. Feel free to contact us directly, and we'll be more than happy to help out. Thanks, everyone, so much for joining us today, and enjoy the rest of your afternoon. Thanks.